Did you think that this was a bold initiative that actually speaks to one of the Prime Minister's key pledges, and that is, we will deal and address waiting lists?
Well, I think it's a really good start. I think it's absolutely vital that talks take place on how to actually improve the difficulties that we're currently finding ourselves in. Clearly, it's very difficult to offer any constructive, any concrete comments on what's happened, because this is all about initial engagement and dealing with a really very complex and challenging problem. I mean, there are pressures on the NHS. I work in Wales now, I've worked in England before. We have slightly different systemic organisations, but the problems that we face are the same. There are massive demand on A&E, there are massive pressure on ambulance services, and the hospitals are larger numbers of hospitals are simply not able to safely cope.
So a loud or a muted hurrah from you for the idea that they will seek to bulk purchase spare capacity in the private care sector to get folk out who've had their operation, are now fit enough to go home if there's someone to care for them.
That is a really good start, but it is a sticking plaster in the longer term, and actually what we need to see desperately is a suitable reform in social care.
I'm glad you looked at Damon at that point, because there's a brilliant article in The Observer today making exactly that point, and there's a lovely picture of you and you're quoted in it. It does require that reform. But it goes back to the Milburn idea with those terrible waiting lists, and you told the researchers that you've worked through the NHS through its worst possible times, and that was about 20, 25 years ago. Worse than even now?
No. This is the worst. This is the worst I've ever known it, without any shadow of doubt. We've always had winter pressures. We've always had epidemics of flu hitting us at winter. I remember the very first year I qualified in 1990, there was a significant epidemic which filled the wards. That continues to happen. That is predictable and will always happen. What we're seeing now is exceptional. We are seeing A&Es completely rammed. We are seeing queues of ambulances outside the hospital. And in my view, the large problem with that is the fact that we cannot discharge patients who are ready for home in an appropriate or early time. And we are effectively working with one arm tied behind our back in the acute sector because of that.
Both sides now are going with the Milburn mantra, and Barclays people are briefing as well that they're looking closely again. Although it can be quite costly, it does have a positive effect, and that is buying yet more capacity from private health generally to clear waiting lists and get people operated on a pawn. You know perfectly well, because you've worked at the front line for so long, that money is frequently thrown at the NHS, and a lot of people like you say that's not the answer, it's structural, it's staffing levels and this, that and the other. But to be crystal clear, this is a good way of spending scarce resources.
In the short term, yes, because there isn't an alternative solution. In the long term, no. Unless there is structural reform to follow, we'll be in the same position next year.